Okay. And again, thank you all for showing up this evening. And let me introduce our presenter this evening, Dr. Barwell. Dr. Michelle Barwell is originally from Greenville, Pennsylvania, and attended Duke University. She obtained her Doctor of Medicine degree from the University of Pittsburgh and also completed her residency at the University of Pittsburgh. She is a board certified psychiatrist and has been practicing for over 20 years. She has provided outpatient care in many different settings, including offices, soup kitchens, homeless and uninsured clinics, severe weather shelters, on the streets, and as a part of community treatment team. She believes that providing good care starts with having a strong collaborative relationship with her patients. And in her spare time, Dr. Barwell fosters and rescues dogs. She grows produce in her local community garden and is an avid baseball fan with season tickets for the Pirates. And I guess in addition to fostering those dogs, you have two dogs and two cats of your own, and hopefully they all get along. So without further ado, let me introduce you to Dr. Michelle Barwell.
Hi, everyone. I guess start by if my name is said, it's fine to say Michelle. I think even after 20 some years, the doctor thing doesn't completely fit well with me. It just feels weird sometimes. And when looking at getting employment, I think it's important to look at a lot of different things. And I've worked in so many different capacities. And whether it's somebody who has a severe and persistent illness and hasn't been in the workforce ever, or has worked here and there, but not really been able to sustain it, or people who have one or multiple degrees and have a really bad episode of an illness and are out of the workforce for a while. It can be very difficult to figure out how to go back in and to do it successfully. I have some figures just from 2019, and there are at that point that year over 46 million Americans with mental health conditions, and over 11 million were considered severe significant illness. Absolutely, mental health issues are the largest cause of disabilities in the United States. But there's a big disparity between how many people work full time. And it's a little less that year, a little less than 40% of people with mental health issues had full time employment, and a little over 60% of people with other types of challenges, disabilities. That's something that is slowly being addressed and worked on, but there's still obviously a lot of ways to a long way to go on it. I would like to kind of do this a little more interactively if people want. If you'd rather I just talk, I will. But I figure a lot of the questions that I have or that come up about this, most people have an idea of at least some of the reasons. So does anyone want to contribute as to what kind of things do you think hold people back and contribute to that 20% difference in employment? Because I can't see if anyone's saying it because I don't know Zoom very well.
I was
So
trying to think of an answer. Sorry.
one of the biggest is fear of stigma and discrimination. We all know that despite a lot of advances, there's still an attitude and stigma at times and in certain environments towards people with mental health disabilities, and especially among people who are not educated and have misconceptions about the the illnesses themselves. And people are often afraid not only of some stigma but and discrimination, but they have some fear of being harassed. And so that's one of the main reasons that people with mental health disabilities don't seek employment. Partially the broader cultural that may not even have to do with specific employment. Another big concern is disclosing. Do you disclose? Do you not disclose? Do you talk about it with a boss or with HR or with colleagues, or exactly what do you do? Um, what do you do if you need accommodations? Concerns about all of those things. And that also can be complicated because the question is not straightforward, and the answer for disclosure is going to be different for every person, and in even with one person in different situations. Sometimes people are afraid that if they do disclose, it will decrease their employability, or they won't be eligible for certain things. And with the ADA, they're not allowed to do that, but people really worry about it. And increasingly, people are more aware, and different employers are trying harder to make mental health care available to people in the workplace. And so having those things accessible to people who already work make it a little easier for people coming in who might have a disability to feel a little more comfortable.
Would anyone be, I guess, nervous about having, for lack of better terms, the symptoms of their mental illness kind of present itself? Would that be a barrier as well to looking for employment? You're just kind of nervous. You don't want to maybe, I don't know, be embarrassed or have something happen at work where you have to, you know, deal with an uncomfortable situation.
Yes, and that's one of the things when I talk about plans to put in place to help you succeed in the workplace. That's one of the things that is very important to be able to identify triggers for when you may be getting sick or having symptoms, to catch things early, and then be able to kind of get things under control.
Yeah.
And
Okay.
so that's people worry about sometimes being tired or having side effects of medicines that people would notice. And so those are all things that can hold people back. People with seizures, people with other illnesses are also on medications that can cause sedation, or so it's not that that's unique just to mental health, but mental health, psychiatric illnesses are kind of invisible, like long COVID or chronic pain. And so there tends to be more judgments passed on people when there are things that can't be seen.
Yeah. Hmm.
As the little digression into neuropsych stuff, it's very interesting. Like on PET scans, you can see where people use glucose because their cells are working, and they can actually identify people who are depressed from people who are not, and people who are suicidal from people who are not. And not that they're expensive, they don't really do much to help someone get better right now, but the fact that you're able to see that stuff, the more and more we learn about it, and it's out there, the more it becomes something that can be seen, and so hopefully that will help decrease stigma as well.
Interesting. So they're able to see that through a PET scan.
Yeah. I mean, just like you're looking for cancer cells that are working faster light up. And so when they do PET scans of the brain, whether they're having you think a certain word or do a math skill, or the part of your brain that's actually functioning more at that point lights up. And so there are places where people without depression will light up more, and people with depression just don't, because that part of their brain isn't functioning like it usually does.
Very interesting. Wow.
Yeah.
Didn't know that.
Yeah, no, and I'm not like a big neuro psych person. Like I'm all about treating people,
Yeah.
but those are the sorts of things that will get us to a place that hopefully this conversation is not about at all about the difference between people who have other disabilities and people who have mental health disabilities.
Yeah.
So that is something I'm really looking forward to.
Yeah.
So given that there are a lot of those fears, the next thing, and one of the big things, let's say that you get a job or you're looking at one, like making the decision whether or not to disclose it is a really big one. And part of that comes down, again, it's individual, and you look at reasons to disclose or reasons not to. The Disabilities Act guarantees accommodations for people who need them. In fact, I've not had to fill out an accommodation request form before. And usually they're more part of a long-term FMLA when I do them, but I have one that I'm in the middle of filling out. So I have someone I've been treating for probably close to 15 years who never needed accommodations. And now, after having, um, brain insult thing, now does, because it makes her ADHD worse, and it's making her everything worse. And that's one of the big points for whether or not someone's eligible first for accommodations, and then when you would seek them. And so, in order to be eligible, you have to have significant limitations in one or more areas, like big areas of life, and you have to have an illness. And luckily, oh, depression, anxiety, OCD, personality issues, schizophrenia, like most diagnoses qualify, if not all, but definitely the big ones do. And then it's a matter of, is it something that interferes with your functioning enough to request accommodations? Unfortunately, when accommodations have been denied, more likely than not, courts have sided on the side of the employer for them not being necessary. Though this woman, who has always had trouble focusing and attending, even with meds, now with a head injury, is not able to have any sort of noise. And they have been working remote, and she needs to go back to the office a couple days a week. And we're asking either that she gets to stay home, or that she's not in a cube where she hears people talking around her, that she'll have a specific designated quiet space so that she can focus on her work. So accommodations can be space. They can be asking for work flexibility as far as hours or time. Sometimes it's for having more time off, as in an accommodation in case you end up hospitalized or needing to go to more intensive treatment, that's accommodated for, so you aren't at risk of losing your job. FMLA is very good for that, but it's only available if you've worked somewhere for an entire year. And so that is, this is also there, that is from the beginning. When you interview for jobs, you don't have to disclose whether you are going to ask for an accommodation or not. You don't have to disclose up front. And when you do disclose, an employment, like a job offer, can't be withdrawn. And as long as it doesn't cause unreasonable hardship on the employer, that, or a situation where it's not safe, or they don't, then it's fine. If it's something that's going to cost an employer a significant amount of money, and it's a small firm and it's not feasible, then they can say no. And so there are other reasons other than, oh well, you don't really need it, which comes up some, but in general, people seem to be pretty accommodating.
So if you're working for let's say a year, and you're able to perform all the essential functions of the job, and there's a job change, and because of your disability, that new task just can't be done unless you have an accommodation. So is it okay at that point to let your employer know that you need an accommodation? My question, I guess, is, can you let them know whenever
Yes, yes.
Yeah.
And in this case, this woman has worked for this company for many years and now is having the issue.
Wow.
I choose someone who's a like a computer programmer who has a lot of issues with delusions and paranoia. And so when he has to work in the office, he worries that and something's not going right with the program. He worries that somebody's messing with his computer. And so he doesn't feel safe. He feels safe, like as far as his person, but he
Mm.
doesn't feel safe as far as trusting in the environment. And so when the company, he switched jobs within the company and it was required that he go in. At first, it was just 1 or 2 days a week. And for a day or two, he managed. And then when it needed to be full time, we asked for an accommodation because of those, that illness for
Yeah.
him to work from home. And they said yes. And he does. He still goes in occasionally if there's like a group meeting, but that's not more than once every month or two.
Mm.
So it's a disability that he was able to still work with without the accommodation until one of the bigger issues with his illness was going to be stressed because of it.
Yeah. Hmm.
So I guess the other things I want to talk about, other than what holds people back, like what helps people successfully get and maintain employment, um, and what things to look for in jobs, and also what um, things you can put in place once you have the job. I think one thing though about disclosure that I was talking more about accommodations there. When you ask for an accommodation, if you work for a big company like UPMC or General Electric, someplace that has an HR department, when you ask for accommodations and your doctor, you have to fill out this paperwork, they're not allowed to disclose to your bosses or to other employees what your condition is. All of that is it's almost like HIPAA. It's just not. It's very confidential and not to be discussed. I know at times people that I've worked with have felt like their boss knew and then told somebody else, and so they didn't feel that it was completely confidential. And I've had some people who worked at small places where HR was the boss. And with the federal, well, with people that work for the big recruiting thing for the service, when I would fill out just FMLA forms or something like this, it all went to their boss. It didn't go to HR, and I didn't realize like that was legal. I still don't think it is, but they do it. So, uh, but in general, if you work for you, it goes there. And if one of the accommodations is that if things get overwhelming, you're allowed to step out. Then you just do it. Like if you're going on a break, if one is that sometimes you may need to leave and go home, you do have to tell your boss that you're leaving and just say, one of my accommodations is that I can leave if I feel like if I need to. And right now I do. And you might assume it's psychiatric, but it could be a blood sugar issue. There are definitely other things that could do it. But if you're going to actually leave, you need to tell somebody. Otherwise, things you can ask for, flexibility schedule, you can ask for extra breaks, you can ask for places to go to take those breaks that feel comfortable. You can ask for a different place like to work like she did, even if it was in the office where it was completely quiet and no one was around. So whatever sorts of things that you feel you need to actually do the job and be successful, it's important to look at that. And some people don't ever need them. And it's interesting because when they asked people and looked at what people would say about disclosing, people who were actually working, most people would say they recommend that people don't disclose. At the same time, a lot of those people feel like advocates for people with mental health issues. And a lot of people also feel like their experiences and their lived experiences with illness actually makes them better at what they do. And sometimes sharing that feels good to share it. And there are part of that could be just the life experience. Part of it is, if you say have done a lot of DBT and are skilled with the dialectical behavioral therapy categories, then you may have better emotion regulation skills or better distress tolerance, or you may be really good at interpersonal effectiveness in a way that other people aren't, because everybody has the ability to be triggered, and not everyone has learned skills to help with that. So another thing. I know I've had depression issues and have been maintained on meds for, gosh, for 30 years, and luckily they work. I would have dropped out of med school the first month. I went to tell someone I was dropping out. She said, "I think you're depressed." I was like, "Really?" And then I got treated. But, so I know what it's like to stop 300 milligrams of Zoloft cold turkey just because your doctor says you need to take it. It's not fun.
Hmm.
And so that's one reason why, for me, I am part of a treatment team with my patients, and we have equal responsibility and equal control. And if a side effect's bothering someone, or they don't like a medicine, or they don't want to take it, we do it together. I may say, "I really think you should take it, but here, let me help you taper off of it." Instead of my doc, who was like, "Just take it," and I stopped it, and it was horrible. But when somebody has withdrawal symptoms, they're like, "It's this weird feeling." I'm like, "Oh, like you turn your head and your eyeballs and your brain aren't connected. You kind of ping pong." They're like, "That's it." Like, in there. So, that, and then my dad with PTSD, a lot of family stuff. I absolutely am a better psychiatrist for having those experiences. And I go once a year to talk to med students during psychiatry about what it's like to have, depression as a med student and why it's important to get treated. Partially do that because there's the suicide rate in the medical profession is so high, and partially because I want people to know it's okay to get treated, and it's not the end of your career, and to help change the culture of being embarrassed to say I have, this illness or these illnesses. So I do think that there are times where I don't tell people. I've dated guys for a year or more and never told them that I had a history or took meds, because they didn't need to know. And I think I look at that the same way as different work environments. There's always that you could tell people up front and be sorry, or you could wait. And then it either feels safe to tell people or not. Places who are more inclusive with diversity as in their employees are much more likely to be open and actually embrace the difference. Other places may not be. I think a big reason for me, and maybe part of why I'm so comfortable talking about my own illness, even with med students, is that I'm not just finishing residency or med school. I've been doing this for a long time, and a lot of psychiatrists refer to me, and I actually treat a lot of doctors. So I kind of already on the legit place. But when you just meet somebody, whether it's at work or in a relationship, if you say, "Oh, well, I've been treated for this," and then you have a really bad day because something's happening at home, or you have a very good reason for being upset with something a coworker did, people are more likely to either be worried you're getting sick or dismiss it and say, "Oh, it's because, she's crazy," or whatever. And so I think that's a good reason, if you don't need an accommodation, to kind of hold back and wait and see if it feels like a safe, good idea or not. If you've been working there for a year and you mentioned to somebody that you have an appointment, with your psychiatrist, or yeah, I've been seeing the same therapist once a week. I saw her this morning, Thursdays, since the end of 1994. And boy, what a difference in who I am. But if you've been working somewhere for a year and 6 months and you say, oh yeah, I have this appointment, people are gonna be like, huh, wow, I really never thought. And so it's not going to be in the front of their heads when they think about you. So the accommodation piece is more for the employer piece. But disclosing in the workplace itself is really a tricky thing. Sometimes it does help. Sometimes you really want to. Sometimes it's better to kind of hang back and wait and see. And again, all of that is individual based on you, your comfort level, the situation, whether or not some of your symptoms. There's nothing saying that someone who actively has symptoms can't work. I have someone I treat who it's been difficult to get voices under control. When they're worse, he can laugh to himself or talk to himself, and he works. And so his boss knows, and it's one of those things where his boss kind of helps if he seems like he's not doing quite as well, just check on him. And it's also something then that makes it so it's not he feels more comfortable when he does have symptoms, because he doesn't feel like people are, he's hiding something that people are questioning. Again, not necessary to
So,
discuss.
you started off by saying, I think, what, 46 million people have, is that people who have received treatment or either
Not
they
not
are or
always.
not?
It's well who are diagnosed with it, so they at least have
Okay.
been diagnosed.
So there's probably even more people out there who have not been diagnosed. And so if you have a job and you're working and you're struggling with something, what's your advice about um, receiving help? Like when should you receive help? How do you get help? Is it when you're just not able to function well enough to kind of do your job, or am I asking the question well?
You mean asking for help from the employer?
No, no, just I initially just to help with any symptoms that you have, to go outside of your employer and say, I think I'm struggling with something, it's affecting my job. Um, I don't know. I
I
guess
may
you,
be the wrong person to ask, since I've been going weekly to therapy for 30 years and I'm 50, 52. But I think that therapy can help everyone.
yeah,
I think that the first thing to do, if you don't have a history of things, or if you do, I mean, there are times when I'm struggling, but I know it's not depression. My
yeah,
meds don't need to be adjusted. I just have life stuff. And so I think those are the times when it's impacting your life. I mean, I part of why I like psychiatry is that, other than say hallucinations, delusions, things aren't necessarily black and white. I mean,
mhm,
I could have symptoms of OCD and they don't interfere. And so it's okay. But somebody whose symptoms aren't much different, I think, something interfacts with happiness, work, relationships, quality of life, then that's a time when seeking treatment is, I would encourage it.
yeah. Okay.
Absolutely. And that's that, because that way just going to talk to someone might be enough. And that's why EAP is there, and why, employers are working harder to make that accessible and okay. And then EAP is maybe 8 sessions, and you can either then continue in therapy, sometimes with that person, sometimes someone else. They can help identify if you might need medications. A lot of times short-term therapy can help if it's work specific. Sometimes you do that and then you're like, hey, this is really good stuff. And so you decide to keep going because there are always things that pop up with work or this person or that issue or
Yeah.
and and then those individuals are trained to recognize if what you're experiencing is to a degree that medication might be necessary or helpful. And
Yeah.
then they would refer you either back to your primary care doc, since there aren't really enough psychiatrists, or if they work with someone that they can have you see as a psychiatrist, then that. But that's, I think that, I don't know, if home is miserable, life can be miserable. If work is miserable, life can be miserable. And so I think that having talk therapy can help anyone feel better in any of those situations.
Yeah. Okay.
So looking at jobs, what like you're better off if you look at someone who's been successful and maintaining employment. The first thing you look at, kind of, how do I do that? Like, I know other people have gotten jobs and they've kept them. I've gotten them and I haven't been able to do it. And, I end up quitting or I get sick. I think that there are several things that need to be considered. Um, the first is that in order to kind of look at full time, you really need to be pretty stable with your illness and you need to have your supports in place and say, hey, I'm going to be getting a job and I may need to call you a lot or I may need to text you. If you're not, if you don't have a degree of stability, and that doesn't mean symptom free. It doesn't mean that you don't have symptoms. It means that your symptoms are stable and you're functioning at a consistent level. If you're not in that place, then you might be better off waiting or seeing if you can do things that are not so much of a commitment as a full-time job to start. So it's important to have that. If you take medications, it's important to stay on them. It's important before you start working to have a relapse plan in place so that people around you, because a lot of times you don't notice symptoms that you're getting sick as quickly as other people do. So part of a support system is to be there to just hear what's going on and see what they can do. I heard or I read a great article in the New York Times where it was a woman asking her sister, who was special education teacher, and kids coming back after the pandemic were having a lot of like difficulty readjusting. And she asked what they do, and she said that the teachers will ask the child, do you want helped, hugged, or heard? And I just thought that was great for everybody, because there are times when we just want someone to listen. There are times when we actually do want them to tell, well, here's what I would do. And then there are times where you just don't want any of it. You just want to hug. And so I think that that's a big piece of having a support system, so that they can be there to help with what you need as you're going through both transition into work and then ongoing. Sleep's important. And so having a good sleep routine, and when you're going to go to bed, depending on when you're working. Physical health is important. Staying in treatment if you have therapy is important. And I think that the other thing is, when you're looking at what job to choose, it's important to choose one that fits with you. If you have skills in an area and you can find a job that utilizes those skills, then it's going to be less stressful and you're just going to jive better overall. If you have an illness that symptoms are triggered, if you don't keep a routine sleep schedule, then you don't want to do shift work like unloading docks or doing different things, working as a nurse on, like a lot of the nurses I treat, they tried inpatient and they're fine. Some it didn't work and they do a clinic or they do a dialysis or things that are Monday through Friday because their sleep schedule really needs to be stable or they get sick. And then looking at what you're like as a person. One of the benefits of working is having kind of a sense of independence, sense of well-being, sense that you're contributing. And for some people, if what they like is to be around others, so having a job where they're part of an office or doing things where they're collaborating, it's really helps them have decreased depression, decreased anxiety, and do much better. Other people don't do so well in those situations, have a lot of social anxiety, or just really need to kind of do stuff on their own. And for them, it may be that stocking shelves overnight or taking a nursing shift that's overnight or looking for a job that's more solo and you don't have to interact with people a lot and there's not a lot of expressed emotion and melee around you. That's also something to consider. So when you're looking at jobs, it's important to look both at like keeping your outside life stable, but also then choosing a job that feels like it fits with your strengths and also your needs so that work stress from interfering with other parts of life or from being in an environment that just is constantly stressful so that those things aren't being triggered and you have a much better chance at staying consistently healthy and then happy and benefiting from all the good things that can come from working. I think that people who kind of are more thoughtful and don't just take the first job that they can get end up being more successful in staying. Some of the other barriers that that are important and some of which are frustrating that 50%, a little more than 50% of people identify one of the biggest concerns is losing their SSI, losing their health care, not having the benefits they need if they work. And so all of the good things that come from working aren't available, and a lot of people want to work. It's one of those things that I can get really fired up about. So I'll breathe a little, and I'm in company that believe that agrees with me. But it's very frustrating when again misconceptions, not being educated about different populations, and this isn't just specific to mental health, but oh well, they don't want to work. Well, you know what, most people do, and people who work, even do volunteer work or work 4 hours a week one day, feel better about themselves and just are healthier and happier in general. And the system is not set up to encourage it because people need medications and they need health care. And if they work even a little, a lot of times, they're going to lose what they have. And then, if you can't get your insulin or you can't get your injection for, your schizophrenia every month because you don't have health insurance, you're not going to be working. And they have just, like health sustaining it, but it's not just about that. There are just so many things like that the system puts as a barrier that keeps people from even trying to get a job and are thought of not individually, but as a group as like, oh, they just don't want to work. So that's, again, I digress a bit, but that really is, they identified that over 50% of people with mental health issues and psychiatric disorders end up not even trying because of that. And that's really shameful because we should not be in a system or society where that's an issue. Yeah. Another thing that really helps sustain employment is having some sort of support, like actual vocational support and coaching, and they doing a lit search that people kind of look through everything, having job skills and training before starting a job didn't seem to do with everyone with psychiatric care as a baseline, but doing pre-job training and skills wasn't as important for people maintaining employment as having a support person and or service in place to kind of help navigate things. So that also, if it's available, can be really helpful. I'm sure I have much more I could say, but I can also stop there if there are any questions.
I have a question.
Sure.
I wrote a bunch down before, but you've covered a lot of them.
Oh, good.
Um, so any advice or thoughts about people who struggle with drug or alcohol addiction, um, uh, and how that relates to employment and either finding a job or maintaining a job? Probably some similar advice to somebody just with a mental health disability, but people who struggle with that, is there anything different than what you've been talking about?
I do think it's important to be in treatment and have supports
Mm-hmm.
because that is essential, again, either way. Drug and alcohol issues don't qualify for accommodations. They're not categorized as illnesses
Okay.
under, the ADA. So that's one difference. Obviously, somebody's not usually not going to be looking for work if they're so active in addiction that that's kind of the primary thing that's going on for them. People who are struggle with it and have relapses absolutely can work. It's a matter of, again, I think having good supports, having a good treatment team, and then knowing what your triggers may be to use something, whether it's alcohol or pain pills or it's I have before. It's been a while, but I know there have been multiple times when somebody that I've treated at Healthcare for the Homeless who was at Salvation Army, ARC, or things, and I'd known them for a long because they kept coming back even when they left there, or that I'm applying for disability. So what do you think? And I would say, because I tend to be honest about stuff, and sometimes it doesn't, it's usually okay. I also underreact, and I haven't had anything bad come from that yet. But there are definitely people that I've said, look, like the last thing you need is money to sit and do and to not work. You're capable of working, and you have a much stronger chance of relapsing into your addiction if you don't have anything to do.
Yeah.
We'll send your records, and I hope that things work out for you, but I'm not going to write anything extra advocating.
Yeah.
I mean, there have been times actually where I've taken off work and gone to court with somebody who's having, their hearing after getting denied for some ridiculous reason, to go and be there in case I could say anything. I mean, I'll call it. It's really important to me that when people need disability, that they get it. And when I don't think someone needs it, I'll tell them, which again isn't always the most popular thing. But I think that being honest with each other, I mean, even in treatment, if somebody relapses on crack, I'd rather have them say, guess what? I relapsed. And I'll say, well, where are you with it? What do you want to do? Because then we're still collaborating partners. So when I don't know what's going on, that I can't help. And so I think that people who have addiction stuff, being able to be honest with their team, and then, working and then working through things. It's someone that I used to see at Healthcare for the Homeless clinics who was amazing at what he did. but he didn't have good boundaries at work as far as not doing other people's work because they were being lazy. So he would do other people's work, then they didn't have to. Then he would blow up and he would get fired. And then he would start drinking again, and it was just that he was in his 50s over and over. And one of the things that helped him eventually get out of that cycle was having a good treatment team that worked on him with how do you stop pitching in and doing other people's work when it's not because they're overworked, it's because they're out back smoking and like looking at their phone. And then how do you manage the feelings that start to come up so that you're able to deal with them before it turns into an explosion and you lose your job, which then, so working on all of that helped then also helped with the alcohol because he was fulfilled with what he was doing. And so it was less likely, that he was going to have huge relapses because he got fired.
Yeah.
So I do think, I mean, I don't think you have to be 100% in recovery for 10 years or even a year to work. I think that again, you need to be stable and in a place where you're able to fit a job into what you need to do for your recovery, and then use supports and, find something that's not going to be too stressful and
Yeah.
isn't going to trigger you to want to use whatever substance it is.
Okay. I think one thing I've taken away a lot. You've shared some really good information, and I was taking a lot of notes. And I think one thing that stands out is that uh, somebody with a mental illness or mental illness in itself can affect anyone in any profession, in any type of job. There's no there's it's it could be anywhere, and hopefully there's definitely barriers and hurdles with our society overall. I think we are making headway. I think we're moving in the right direction. I think employers are becoming uh, more understanding in overall with people with disabilities. But mental illness can be difficult because, like you said before, it it it's a hidden disability. I worked with somebody for a few years who never wanted her employer to know that she struggled at times at work and because of her disability. And so we worked behind the scenes. When she was done working for the day, we would connect and kind of process what she did. But so anyway, this was fascinating for me. I hope everyone else has had uh, a similar reaction.
You just brought up something like that. I mean, it can affect anyone at any time. I remember this primarily because it was three people on the same day, which like is weird. Sometimes if something comes in a couple times a week that you haven't seen in 10 years, you're like, wow. But I had three different men come in who were over 50, between 50 and 70, who were having panic attacks and had never had them. Huge workups with cardiology and everything done for their heart, and eventually told, well, you know what, you're having panic attacks, you need to see a psychiatrist. And they would come in, and this was maybe close to 20 years ago. So those are men that would be in their 70s to 80s now, and the stigma of saying I've got that for someone in that age group is definitely higher than for somebody who's 20 right now. And they were like, I don't know why I'm here, and they're not right, and I'm not crazy. And I explain panic and say, a little medicine will fix it. It will get rid of it. Yeah, but I don't need that stuff. I'm not crazy. And then the other piece was that the medicines we use for panic, Zoloft, Prozac, they're like, I'm not depressed. Those are antidepressants. So it can be difficult.
Yeah.
And And I think that those three men, it was the first time that I had ever really self-disclosed
Mm,
with patients. And I have more as I've gotten more confident in my, like the more experience I get, the more I've grown into to the job. But I looked at him, I was like, you know what? Like, I take medicine for depression. I'm not crazy. And they're like, you don't seem crazy. And I'm like, nope. And in fact, if I didn't take it, I would have never finished med school, and you'd be telling somebody else that you're not crazy. And what the medicine does is take away the illness so that you're yourself.
yeah.
And I all three of them looked at me like,
Mm,
what? And they all started taking medicine, and they all got better. But it can hit anyone at any point. And employers have been better. I've had two different people who were so good at their job but had alcohol problems, and they would have to take a 30-day period at a time to go to rehab and detox. And sometimes twice a year, at least once a year, for I saw with each of them maybe 4 episodes. And their employers just said, okay, your job's here. When you're better, just go get help, because they were so valued. And they were smaller companies, but so valued for who they were and what they gave, that the employers were very happy to work with them getting healthy. and
yeah.
and I know that going in the hospital, if things would get bad, is the same sort of thing. A lot of companies are like, look, get better, come back when you're ready.
Yeah.
So I think that fear of relapse, not just drinking alcohol, but relapse into
Yeah.
your symptoms of illness, shouldn't necessarily be a reason not to look for a job. I do think that you should be in a stable place to start,
Hmm.
to maximize your chance of succeeding. But you know, you don't have to be 100%. And then there are a lot of people that live, even people you would not know, that I treat people that you would never know that they still have panic attacks, or
Yeah.
that they have such bad anxiety every day driving to work that they have to pull over and stop a few times. and
Mm,
and so you don't have to ever be 100% symptom free to be really good at what you do and to work. And if you can maintain full time and that's what you want, great. If you don't want full time, don't start with that, and or don't even try for that, and just do something part time. But it feels good for everybody to work and contribute, and be part of the bigger society.
yeah. Well, excellent. Thank you so much for the time you have given us. Again, I took a lot of notes, and you hit upon all the questions that I was wanting you to answer. And but yeah, so with we felt that it was really important to have a special session on mental illness, because of the scope of how many people it affects, and uh, and that it is at times, many times, a hidden disability, and it kind of, we felt like it needed its own time. So again, Michelle, thank you very much for your
Welcome.
time, and thank you everyone else for attending.
Thank you.
So everyone
Have a
have a wonderful night. Be safe with the cold winter weather coming up ahead, and we look forward to seeing you in future sessions.